Hello, everyone. I'm Dr. Joseph Chinchu Guo. I'm currently the Director of Big Data Center at China Medical University Hospital, CMUH. I received my MD degree at China Medical University and received my PhD degree at Johns Hopkins Bloomberg School of Public Health for epidemiology research. I'm also the founder of iHi platform of CMUH. I'm also served as editorial board member in the American Journal of Kidney Disease. Today, I'm going to share our experience in how to harness medical big data platform to develop digital therapy in kidney disease in Taiwan. Today, I'm going to divide my talk into two sections. Firstly, I'm going to give a brief introduction on our iHi data platform. iHi means Ignite Hyperintelligence. Secondly, I would like to share a case study about how we develop a digital solution for acute kidney disease care in the outpatient setting. This process helps us to identify a major challenge in translating big data medicine into real-world practice. Now, let's start from the iHi platform. In my opinion, the perfect metaphor for a big data ecosystem and platform is a Japanese-style garden. The beauty of a Japanese garden is that they condense a multitude of things into one mini garden. Similarly, an effective data platform should have these characteristics. The focus is on the quality and details as opposed to volume of data. The information must be harmonized and can be easily accessed and analyzed. The paradox or seemingly contradictory challenge in AI is in scaling up its application and to roll it out to be applied across a range of projects. The last mile challenge is therefore how to scale up the AI framework in real-world projects. To solve this last mile challenge, we require a comprehensive data ecosystem as the key engine to drive the medical AI industry. Over the past 6 years, while working diligently toward implementing meaningful AI solutions at the bedside, we have identified several pain points. First pain point is the data silos. We have to ensure the data interoperability, and then we can prevent so-called AI silos or solution silos. The second pain point is controlling the impulse of utilized deep learning, as more attention should be given to data quality. Solely cleaning and understanding the data is always more crucial than computational approaches. The third pain point is that most medical institutions prioritize the application side and overlook the design of data architecture necessary to support the efficient deployment of AI solutions. With our robust and user-friendly data architecture, it would be challenging to achieve sustainability in a renewable medical AI ecosystem. Finally, what defines a high-quality intelligent data ecosystem? It is the data service platform that showcases an efficient pipeline and sufficient interoperability to maximize the client's data capacity. Using the metaphor of data Lego is an excellent way to represent this performance. In 2020, we launched the iHi data platform, which is a thoroughly cleaned and well-orchestrated data platform. On this slide, we can see a screenshot of the iHi platform accessible on the intranet of CMUH. This data service platform contains diverse data from 3 million patients with a 19-year follow-up, making it only real-time connecting phenome the genome database in Asia. If we examine the circle in the center of the slide, we can identify data sources incorporated into the platform, such as visit records, surgical records, procedure reports, and more. iHi Genomics is one of the critical services of the iHi platform, and is the only data service platform in Asia that allows researchers to operate longitudinal phenome and the genome in real time. The validation sample size has currently reached 40,000 patients. During the operating process, we provide a dashboard to summarize information, and the users do not need to program. Within 24 hours, the system automatically generates a high-quality GWAS report for applicants. The foundation of these value-added data applications underscores how deep cleanliness is a game changer, similar to Lego that creates a niche for the CMUH AI ecosystem. The slide represents the interoperability of the data bricks within the platform. In the center, we can see the main sources of data generation on the iHi platform, including outpatient and inpatient departments, emergency and demographic information. Surrounding this, we have types of data groups such as lab reports, operation records, and more. The honeycomb cells represent well-cleaned, high-quality data grouped according to diverse clinical topics, such as data sets of ICU, cancers, CKD, or surgical procedures. This highly cleaned data enables researchers to extract bespoke and meaningful insights into patient care and treatment outcomes. At iHi, we are passionate about customizing spatial data bricks. And the strength of our iHi platform lies in its high degree of adaptability and data resolution. In addition to provide a macro view, we can zoom in on the data capacity to the genetic level. We have also recently integrated microbiomics into the data service, adding another dimension to our platform. Building on our robust data infrastructure, we have developed a spatial data service called Smart Data Chip, supported by the full spectrum data ecosystem and the data to AI and AI to data annotation cycle. And we have developed a unique fabrication pipeline for it. This diagram depicts the entire data chip generation process, from the initial inventory of data sources and architecture design to the final smart data chip production. During the data polishing stage in the third box, our clinicians translate their clinical knowledge into the data, which is then deep cleaned. Another essential step in this pipeline is the data refinement process, which involves conducting a plausibility check and selecting certain features to augment the data capacity. The final stage in the design process is data staking, which entails accurately mapping the clinical data annotations, enabling researchers to define clinical phenotypes with high-quality precision to achieve ground truthing. This slide presents the complete spectrum of our big data ecosystem. On the left-hand side, we have the real-world data ecosystem, where we connect our institutional electronic medical records, the iHi platform, and the national insurance databases. Through this ecosystem, we can track the life trajectory of our patients by integrating both institutional and external health data. On the right-hand side, we extend the real-world data ecosystem to include genomic, proteomic, environmental, and microbiome data. This completes our multi-omics ecosystem, which forms the infinite data loop at CMUH and provides a robust foundation for scaling medical AI. Deep clean data produces high-quality development inflow for AI, enabling high-performance AI that serves as a novel digital marker and enhances the diversity of data and its potential applications. I like to think of this process as brewing a smart data ecosystem. As we develop more AI, we will have more cleaned and diverse data, creating a positive feedback loop. These unique data operations highlight the key mindset of the Big Data Center at CMUH. We aim to maximize the data capacity of our clients and researchers, enabling them to extract the most valuable insights from our comprehensive data ecosystem. In the second section of this presentation, I wish to share a case study on how we translate the data insight into a real-world practice. Taiwan has been known as a dialysis island since 2000s, and currently the treatment of this single disease incurs the highest cost under Taiwan's national health insurance, amounting to over 50 billion NT dollars per year. And how can the iHi platform support kidney disease prevention? In this case study, the iHi platform can provide a corresponding database that aligns with nephrologist's way of thinking, specifically regarding the patient journey of chronic kidney disease. Following that, using a subway map as an analogy, we can sketch a map of unmet needs in clinical kidney disease prevention, where each station represents a critical issue that we aim to solve. A smart data service enables us to provide accurate, relevant, and high-quality data for each topic to help clients or researchers answer their hypotheses and validate their study findings. We can build a specialized research platform for kidney disease using diverse data elements, from clinical characteristics to environmental factors, to target major kidney disease categories such as CKD, HD, or PD. Through careful analysis such as advanced statistics, including machine learning, this will enable us to identify new kidney disease prevention strategies that can be easily translated into clinical practice. For instance, the conventional CKD care model doesn't yet consider the impact of AKI, as it is challenging to accurately diagnose AKI, the acute kidney disease, in the outpatient setting. AKI is a typical inpatient diagnosis, and the main reason for this is fragmented data across medical institutions. In Taiwan, the National Health Insurance Administration has implemented a cloud-based cross-linked national health database similar to a national EMR, which provides an unprecedented opportunity to innovate data-driven healthcare applications. By connecting institutional and national EMRs, we are able to track the trajectory of a patient's kidney function, eGFR, within 180 days prior to the outpatient clinical visit. This enables an accurate diagnosis of AKI in the outpatient setting. The left-hand side shows possible AKI scenarios, and we have designed corresponding actions for these novel phenotypes, as shown in the figure on the right-hand side. Here are the preliminary results since the system was implemented in the Health Information System of CMUH in 2017. We found that the prevalence of outpatient AKI remains stable at around 7%, with approximately 700 patients requiring mandatory referral to nephrology service each month. However, to our surprise, less than 15% of patients with outpatient AKI were actually referred for nephrology care. Furthermore, we found that patients with outpatient AKI harbor a 5 times higher risk of developing ESRD than those without, highlighting a significant kidney prevention gap in the current Taiwan's public kidney health network. I would like to use this slide to conclude my talk today. Throughout the presentation, we have emphasized the difference between smart data and big data. Big is simply not enough. With a smart data platform, we can design personalized digital therapies. Our case study showcases the paradigm shift towards smart precision kidney care. Additionally, iHi provides the best use of data intelligence, empowering healthcare product and IP cycles. Finally, I would like to thank our big family, a team comprising diverse talents from data scientists, data ontologists to AI and IT architects. Please join CMUH in promoting personalized health through data intelligence. We welcome international collaborations, be it in the academic or business sphere. It brings us great pleasure to work with partners from different parts of the world. Thank you.